Welcome to the Smith & Nephew Wound Club online module on the importance of an infection management pathway, which forms part of a series of modules you can access to develop your knowledge and understanding around infection management. My name is Sherry Pearce, Complex Wound Specialist at Smith & Nephew. Today, we will be discussing the importance of an infection management pathway. By the end of the module, you'll be able to understand how an infection management pathway can potentially improve patient outcomes, reflect on the different signs and symptoms of infection, and identify appropriate treatment of biofilm and local wound infection. Pathways in general have many benefits for clinical practice. They help to reduce variations in clinical practices, communication through continuum of care, help improve clinical outcomes and improve formulary compliance. When pathways are supported by clinical evidence, they promote organised, efficient and effective patient care. Based on global practice in clinician survey feedback and in collaboration with international wound experts, the infection management pathway was created and published to support and guide clinical practice. The pathway is designed to give the clinician confidence when diagnosing the type of wound infection that is being presented. In the following slides, we will break down each section in more detail. Treat the whole patient, not just the hole in the patient. In order to manage your wounds appropriately, a comprehensive assessment of the patient, their environment, wound etiology and wound are necessary, as all of these components affect healing trajectory. Specifically, a comprehensive assessment of the patient well-being and the wound is recommended with the ABCDE method. A. Assess patient, well-being and wound. Review history, associated comorbidities, limitations to wound healing and formulation of diagnosis. B. Bring in multidisciplinary team. This includes caregivers and specialists to ensure a holistic approach to care and treatment. C. Control. Management of factors contributing to wound development and barriers to healing potential. D. Decide. Formulation of an appropriate plan to action to treat. E. Evaluate. Continuous assessment of the patient and response to treatment intervention. Specific to wound infection, comprehensive assessment supports early detection and aggressive intervention of strategies. Assessment begins with recognition. Recognition of signs and symptoms of wound infection is crucial for healthcare professionals. The initial diagnosis of a wound infection is a result of the clinical assessment of the patient, the wound, and the peri-wound tissue. The wound's etiology contributes to infection risk, development and the immune system of a patient to defend against infection. Acute or overt infection is usually obvious to experienced clinicians as these wounds present with the classic overt signs and symptoms of wound infection. However, the covert or subtle signs and symptoms of infection are more challenging to identify. As recognition and diagnosis is of the utmost importance, let's examine the infection management pathway further. Spreading or systemic infection describes the movement of microbes beyond the local wound environment to affect other tissues, organs and systems throughout the body. Patients falling into this category of the pathway need urgent specific treatment to halt the progression of infection to sepsis. Specifically, collaboration with specialists to enable rapid treatment with systemic antibiotic therapies is required to prevent rapid deterioration. Acute or overt infection is usually obvious to experienced clinicians. Erythema, increased redness of the tissue as a result of increased dilatation of the local vasculature. Warmth, result of increased blood flow and information battle between bacteria and host immune response. Edema, result of increased blood flow and inflammation response. Purulent discharge, composed of white blood cells, largely neutrophils, that have been fighting the increased microbial burden. Pain can be due to a myriad of factors, including bacterial secretion, and local impact on the nervous systems, additional pressure created by edema, high sensitivity associated with immune response, increasing malodor as a result of bacteria metabolic activity, proliferation and tissue deterioration, delayed wound healing, result of an increased inflammation and deterioration of tissue due to bacteria. Recognition of these classic signs and symptoms are captured in the next layer of the infection management pathway. As we continue on to the next layer of the infection management pathway, a holistic approach continues in treatment of the patient. Ongoing patient and wound reassessment should be performed to gauge progression. During the initial 2-week challenge period, clinical efficacy of the silver dressing can be assessed. If after 2 weeks there is improvement in the wound but continuing signs of infection, it may be clinically justifiable to continue the silver barrier dressing with further regular reviews. The wound has improved and the signs and symptoms of wound infection are no longer present. The silver barrier dressing should be discontinued. There is no improvement. The silver barrier dressing should be discontinued and consideration given to changing the dressing to one that contains a different antimicrobial agent. Once the bioburden is under control and the wound is improving, a non-antimicrobial dressing should be considered. As we refer back to the infection management pathway, prompted questions support the 2-week challenge principles and provide a gateway to an alternative infection management strategy should signs and symptoms not be resolved. Sometimes signs and symptoms of infection do not resolve and antimicrobial treatment fails. When this is recognised, it is important to re-evaluate the patient and the wound. Is there more to the story? Potential for covert or biofilm infection. While classic or overt infection is usually obvious to experienced clinicians, the covert or subtle signs and symptoms of infection are more challenging to identify. It is important to recognise and differentiate from overt infection. Covert or subtle infection differs from overt in the presentation of the localised signs and symptoms. Covert infection is more subtle and largely attributed to bacterial agitation of the host immune response, triggering low-level inflammatory stimulation. Ongoing inflammation leads to delayed wound healing. Progression through the phases cannot be completed as inflammation continues. Continuous serous drainage with inflammation. Response as the body attempts to combat wound microbes. Hypergranulation, friable granulation, epithelial bridging, pocketing granulation, all products of the increased moisture and underlying bacterial contamination leads to abnormal unhealthy tissue growth. Wound breakdown and enlargement results from bacterial deterioration of the tissue as well as unhealthy environment created with ongoing inflammation. New or increasing pain can be due to a myriad of factors including bacterial secretion and local impact on the nervous systems, additional pressure created by edema, high sensitivity associated with immune response, increasing malodor, a result of bacterial metabolic activity, proliferation and tissue deterioration. As covert infection is less obvious, vigilant attention must be due in dressing changes and assessment should be given to limit propagation of infection. Additional referral to recent wound documentation helps to more quickly identify anomalies and chart progression. Another less obvious diagnosis of infection is the clinical presentation of biofilms. However, there are some common characteristics associated with biofilm formation. Many clinicians start treating a wound gently, then ramp up treatment severity if the wound does not respond. This approach may waste time and money and cause prolonged patient suffering, but the opposite should be done if a clinician suspects biofilm. Biofilm-based wound care, or BBWC, encourages aggressive debridement, specifically sharp, in addition to topical cleansing, and continued treatment with a known biofilm disrupting and prevention topical agent. Bacteria have been shown to live deeper in the wound tissue. This combined with persistent nature of biofilm bacteria, requires the 2-week minimum of topical treatment. Often, a clinician may stop treatment too soon in covert and biofilm-associated wounds. This pullback may lead to infection reoccurrence, healing delay and wound regression as the remaining microbes rebound and begin proliferating again. Once the signs and symptoms have subsided and the wound is positively progressing, transition to non-antimicrobial dressings and advanced therapies are indicated as the next steps in the infection management pathway. This transition supports antimicrobial stewardship, AMS, as a means to maintain maximum efficacy for the future. Wound infection is complex and challenging. The pathway can help as a quick reference tool to guide diagnosis and appropriate treatment for infected wounds or those with suspected biofilms. Build confidence in practice, no more guessing. Guide early effective intervention. Encourage appropriate antimicrobial use. Support consistent approach across teams. Using pathway may help to improve patient quality of life, improve clinical and economic outcomes, improve resource management. Thank you for your time and attention today. To check your knowledge and understanding, try and answer the quiz questions. Well done. We're now at the end of the module. Take the time to reflect on how you will take some of what you've learned and apply it into your daily practice. If you're on the NMC register, then please click the link in the description below to access a copy of the revalidation form. The form is in 2 parts with a front sheet where you simply fill in your details and back sheet which allows for deeper reflection. Adding to this reflection will mean you'll be able to claim extra CPD minutes. Thank you for your time today, and please remember to look out for the other sections of the Smith & Nephew channel to access additional modules to help you on your learning journey.